Series. This is our monthly seminar. It's the second Wednesday of the month. And I hear an echo.
I think it's the other room.
Is that the other room?
But it's just out of the way.
Okay. So welcome. I'm Flocke, and I am Associate Director of the Prevention Research Center for Healthy Neighborhoods. Welcome to everyone. We have some new faces here today and some familiar faces. If this is your first time at the seminar, can you raise your hand for us? So welcome to all of those that are new. I invite everybody to sign in on the sign-in sheet. That way we can know who's coming and be able to track that. But then we can also, for folks who are new, get you on our mailing list to let you know about upcoming talks and other special events that might be coming on that might be of interest to you. Certainly share that with colleagues and friends who you think might be interested in this series as well. Everyone is welcome to attend. Today's presentation is a very exciting one involving lots of partners, lots of individuals, and really represents a massive amount of work to date, but is exciting because it's the first of several steps. So we're really delighted to have this presentation focused on the FreshLink project. And our speaker today is Darcy Freedman. Darcy is an Associate Director of the Prevention Research Center and is also an Associate Professor in the Department of Family Medicine, I'm so used to saying that, Department of Epidemiology and Biostatistics. She also has an appointment in the Department of Nutrition, if I have that correct. Yes, social work. And is the principal investigator and lead on this project. I get to co-present on that, and so you guys have already heard about me and who I am, but we're going to tag team on this presentation. Our plan is to present for about 40 minutes and then leave some time for discussion. And I think with this very diverse group that we have here in the audience, we should have a pretty rich discussion of this project and where we're headed. So welcome, and without further ado, Darcy.
Great.
Oops, I guess like this. Is that good?
Yep. And put that in your pocket. And the pointer's over there.
Okay.
And the pointer, yeah.
Can I turn one of these down?
Sure, that'd be great. Great. Well, welcome everybody. It's good to see so many faces here, a lot of people who are directly involved in the FreshLink project. And it's just wonderful to be able to present the first time ever sharing the results of our survey data from the FreshLink survey right here in Cleveland, right in the home of the PRC. So it's exciting. The presentation that you're going to hear today represents the work of a lot of people, as Sue mentioned earlier. And so you can see we have a number of investigators, partners, consultants, research assistants, and community partners. So if you are a member of the FreshLink team in any of these ways, will you just raise your hand high so we can see how many people are a part of this group? And thank you so much. Thank you. I also want to give a special thank you to the director of our PRC, Dr. Elaine Borowski. If you've not met Elaine, this is really the work of a number of years. The work that you're hearing today is really a tradition that's been going on in the PRC and carrying forward into our new grant cycle. And I also want to thank Kristen Matlack, who many of you probably know or have at least received an email or a call from. Kristen is the program manager for FreshLink, and truly we would not be presenting what we're presenting here today if it wasn't for Kristen's leadership and push on the project. So thank you, Kristen. In addition, I want to acknowledge the main partners of FreshLink. We have a project that includes a lot of partners, and some are coming in at various stages, but throughout the entire 5-year grant, we have a partnership with the OSU Extension, Cuyahoga County, the Cleveland Cuyahoga County Food Policy Coalition, the Office of Job and Family Services here in the county, and the Prevention Research Center for Healthy Neighborhoods network of community advisors. So I see many of you in the crowd as well. Thank you for your support on the project. So one quick funding disclosure. We are funded by the CDC to conduct this research. We're one of 26 prevention research centers funded across the country. But the results that we're presenting here today are representative of our team and do not necessarily represent the official views of the CDC. Exactly, that was great music for that note. Okay, so our agenda today, we're going to review briefly the goals of FreshLink. It's a 5-year project focusing largely on year 1, describing our survey methods. Sue's going to talk about the preliminary findings from our survey, and then I'll come back and give a few ideas for implications, but mainly we want to open it up for dialogue with this group for implications. FreshLink. FreshLink is a 5-year project that has a goal to promote health by improving access to fresh and healthy foods in neighborhoods. Our project goes in 4 parts, but they're not silo parts. If you see the people on the road, they're going both ways. So our stages is a planning phase, which is the phase that we're in right now, and our survey research is part of the planning, and we're actually already moving into the next phase of planning, which is a in-depth interview phase. The growing phase involves the development of some interventions designed to improve the reach, adoption, and impact of farmers markets among low-income consumers in Cleveland. And study is a process that we're doing throughout in various ways using various methods. And then the last bullet you see up there is the sharing phase. One of the focuses of our PRC is to regularly disseminate early and often the findings so that they are able to be utilized here locally. There's a lot of relevance here, but we're also very interested in sharing our findings regionally and nationally. Cleveland is ahead of the curve when it comes to a multi-component approach to implementing food access interventions, and we feel like Cleveland has a lot to offer in terms of where other communities will be going in the future. Our overall goals to work hand in hand with our community partners to employ a rapid response system for evaluating and improving the reach, adoption, and impact of farmers markets and the double value produce perks program among SNAP recipients living in low-income neighborhoods in Cleveland. So why do we focus on farmers markets? Just a little bit of rationale. There's evidence that eating at least 5 servings of fruits and vegetables every day is associated with decreased risk for all-cause mortality. So if you look on this slide here, the blue line is a curve of risk for all-cause mortality, and you can see a substantial decline right at about 5 servings per day. So it would be wonderful to eat more than 5 servings, but if you're at least getting 5, there are major health benefits. And when it comes to nutrition, there's a lot of ambiguity in terms of what exactly we should be doing, but there's fairly conclusive evidence that fruits and vegetables are unanimously good for health overall. But when it comes to consumption of fruits and vegetables, Americans aren't doing very well. So this is a look at the My Plate recommendations. This would be 100% of the recommendations. So for meat, eggs, and grains, we're doing very well. In fact, we're consuming more than we need to in terms of those items. But when it comes to fruits and vegetables in particular, we're well below the recommendations. And this is a trend that's been consistent over time. So despite multiple efforts to improve fruit and vegetable consumption, there's been essentially no change in this behavior. And even though this is a fairly stagnant trend, the CDC has identified improving fruit and vegetable consumption as what they call a winnable battle. And that can be achieved by making nutritious foods, and this is their language specifically, the easy, attractive, and affordable choice. And I note this here because of the affordability factor and our focus on the Healthy Food Incentive Program locally as a part of our overall study design. Specifically looking in Ohio, more than 1 in 4 residents consumes less than 1 vegetable per day. And compared to other low-income adults, SNAP recipients consume fewer fruits and vegetables and more low-nutrition, high-calorie foods, so for example, sugar-sweetened beverage or highly processed foods, and are more likely to be obese compared to low-income Americans. So that really helped us narrow in on the SNAP population as a target for the FreshLink project. Farmers markets are a recommended strategy for improving fruit and vegetable consumption. They're recommended by the Institute of Medicine, the CDC, the U.S. Department of Agriculture, the National Collaborative on Childhood Obesity Research, just to name a few. And Cleveland, as I mentioned earlier, is what we would like to refer to as a natural laboratory for looking at farmers markets as interventions for population health promotion. So these are data coming from the CDC, looking at the number of farmers markets per 100,000 residents, and the percentage of farmers markets that accept SNAP. These may be slightly dated. This is from 2013 data, but the main point I want to make here is well ahead of the curve. We're well above the national average in terms of the number of farmers markets per 100,000 residents, above the average for the state as well as even for the county within the city of Cleveland. In addition, I think this is probably the most notable, is we have 100% of our farmers markets in the city of Cleveland accept SNAP, EBT at the market, yet nationally only 21%, so about 1 in 5. Even in our own state, we're substantially above the average in terms of that. So this is, yay! This is amazing. And it creates, again, the natural laboratory to study these multi-component interventions. When we think about the FreshLink project, we're conceptualizing food access as a multi-component phenomenon. So this is a model that my team developed where we're saying nutritious food access is related to 5 domains: economic, service delivery, spatial, temporal, social, and personal. And here in Cleveland, we have things going on in most of these domains. So for example, in economic, we just saw EBT, SNAP at all the farmers markets. That's a huge barrier to being able to use SNAP at a market that we already have covered here. We had a Produce Perks Healthy Food Incentive Program, and that's been going on for a number of years in our city. In terms of service delivery, there's wonderful marketing for Produce Perks. If you've not seen the marketing, I have one slide here, you'll see it. We have many markets offer new customer welcome packets and have welcome booths for SNAP EBT customers. In terms of spatial temporal, there have been 8+ policies passed in our city to support urban agriculture, largely the result of our food policy coalition in the county. And there are high numbers in markets in the urban core. And then in terms of the personal, we have a number of nutrition education programs going on, such as expanded food and nutrition education and SNAP Ed being implemented through OSU Extension in the county, and a number of produce prescription programs, including those focused on mothers, people with various chronic diseases, and these programs are expanding. So we have a lot going on from a multi-component perspective. In the social access, there are some things going on. It's not to say nothing is there, but there's not a systematic approach across the city around improving social access to farmers markets. And so when I say social access, I'm talking about social norms, cultural foodways, feeling accepted and respected and trusted in the market space, things like that. One final point in terms of the FreshLink project, we think about this world that we're in, this Cleveland laboratory, from both a supply and demand perspective. And on the one hand, there's been a huge push or supply of this multi-component farmers market intervention model. But our question is there corresponding demand from the low-income consumers? And how do demand and supply work together to hopefully achieve the goals of both markets and low-income consumers in our city? So our main research questions that we'll be talking about today, or alluding to today, and these guide our year 1 of FreshLink, is one, among SNAP recipients living in close proximity to a farmer's market in Cleveland, how are people who've shopped or not shopped different in terms of their attitudes, beliefs, and behaviors? Our second question is, and this is really important, what are the potential modifiable factors at the individual level, the market level, and the community level to improve the reach, adoption, and impact of farmers markets in our city? And then lastly, and you're not going to hear a lot about this today because this is largely our next phase of planning with the interviews, is to look at what are the best channels for communication for boosting supply and demand of farmers markets. So in terms of our methods, we're presenting today on survey research. This process of being able to present today, really about a year ago, a little over a year ago, we began planning for the survey. And in that process, we've did a pilot testing of our survey, phase 1, where we tried the survey out with just 2 community residents. We tried it out in person and over the telephone because data were collected both ways. That guided a lot of refinement. The phase 2, where our community researchers then were involved in practicing it, again with community residents by phone and in person. In May of this year, we hired and trained 5 community researchers. Marilyn Burns, who I see right here. Dominique Rose, who's actually a PhD student now in Illinois, so she's not able to be here today. Deetta Brown, who's in the back. Yvette Wilson, who's right here in the middle. And then Rachel Gardenhire, I don't know if Rachel's here. And Rachel's way back there. You can't see her. So these women went through 40 hours of training in terms of the methods of collecting the survey data so that we were using a similar process. Kristen led the way with taking them through the process. They all completed training in human subjects research in addition to that training. And when they recruited, these were the eligibility criteria to join the study. So you had to be on SNAP. You had to be participating in food shopping for your household, reside within 1 mile of a farmer's market in Cleveland, and again, back to our laboratory point, we have 17 farmers markets that straddle East Cleveland and Cleveland. This is amazing. And we had a 1 mile buffer, so all the light green areas are the 1 mile buffers between, around these 17 markets. They had to have children living in their home, at least part-time, be 18 years of age, and we offered our survey in Spanish and English. So who's in our study? We approached over 1,000 people. Of those, 910, so about 77%, were screened. And of those, 360 were eligible, and nearly 99% of those who were eligible decided to consent and join the study, which is really impressive. So once we found people who were eligible, they were interested in joining. And then ultimately, 322 people, about 91% of the total consented, completed the survey. And for the presentation today, we're presenting on 304 usable surveys for analysis. We did a total recruiting at 17 partner sites and 37 recruitment events that these women were at, very actively getting folks interested in joining the study, and it was a lot of work. So in terms of where were people coming from? We thought to get people who shopped at farmers markets, we had to recruit at farmers markets. Well, we were wrong. We were able to get a lot of people who shopped at farmers markets by recruiting in these other places, largely coming from job and family services, food pantries, and other places. Very few people were ultimately recruited at a farmers market, which is pretty exciting and a little bit of a prequel to the data. In terms of who joined the study, majority were women, Black or African American, not currently employed for wages, with annual household income of less than $10,000. Most people were not married or living with a partner, and most of the people had 2 or more children living in their household. We had a little bit more variability, which is good in terms of our age range. Most people were in the 28 to 37 range, but we have a wide range from 18 to 48 or more years. And then in terms of level of education, we had most people at the high school graduate level, but we had people with higher and lower levels of education. I think this is an important slide to point out just for, focusing in on why this study is so important locally. These are the self-reports of health status, so FreshLink in blue, nationwide in orange, and gray is Ohio. And you can see for FreshLink we trend toward here. Good, fair, or poor self-reports of their health. Whereas nationwide in Ohio, we trend toward excellent, very good, or good. So this is a population that's self-reporting that their health status is not very good. Yes?
Is this relative to similar populations at the national and Ohio levels, state levels?
So we have a much lower income. So these are both nationally representative samples. In terms of the participant demographics, more than half of our sample reported that they have a chronic disease. So diet-related chronic disease, diabetes, hypertension, and some people having multiple chronic diseases. And now I'm going to shift it over to Sue for presentation of our findings. Actually,
I took your chair.
oh, there's it there.
Great. It's a problem with no pockets. Alrighty. So there was a lot of data collected about food shopping and food shopping behaviors, and then some very specific data around farmers market shopping. So what I'm going to present first is the basic information around food shopping. And there were questions around their primary food shopping place and then a secondary food shopping place, the nature of it, how frequently they go, and how they get there. So I was going to share a little bit of information on this. So here's a distribution across the different types of places for food shopping, and you can see that it was most common to go to a supermarket for both your primary and your secondary store, or a discount type of store. In terms of general food shopping patterns in the stores, most people reported shopping with their family. So who did they go with? They tended to go with their family about 60% of the time, both for their primary and secondary store. With regard to how they got there, this seems to be a very important issue, and it's whether or not they drive their own car. In this sample of 304 individuals, only 42% reported that their primary way of getting to the store was that they drove their own car. For the other almost 60%, they used one of these other means, and with someone else driving being the most common. So when it comes to a summary of places of where they went to get food beyond, so including their primary and their secondary, but looking at all places where they get food, these were the most common. These were the most common responses. So it's ordered by frequency, and the ones that are in red are highlighted as places of food insecure, where you would go if you're food insecure. So it was actually quite common to go to a food pantry, bank, or shelter among this population. 62% said that they had done that. Okay. When it comes to how frequently you go to buy your foods at your primary store or secondary store, What this is showing, let's see, where's it's this one? There we go. On this axis, it looks at what that frequency is, and you can see it's most common to go once or twice a month. This, 4 times a month, would be basically once a week, and you can see that that's only about 11 and 12% of the population of respondents here, so that they went food shopping once a week. Okay, it was much, much more common to go either once or twice a month, so infrequent food shopping. Okay, which makes it a little bit challenging when you're talking about buying fresh fruits and vegetables. Okay. Now we're going to talk specifically about farmers market shopping. One of the key questions that we asked was around the frequency of farmers market shopping and if there had ever been. So starting at the bottom, what we see is that a third of our population, 32%, said that they had never been to a farmer's market. About 26% had said that they had been, but not within the past year. And the part that was a bit striking was the frequency with which farmers market shopping in the past year actually was reported in this sample. And again, remember where we went to go do the sampling to reach these individuals that met the inclusion criteria of having SNAP. We were at Jobs and Family Services, we were at different community centers, and at some food security places, and not so much at farmers markets. But that what we show is that 42% shopped at a farmers market in the past year. Okay, so that actually is terrific from an analysis perspective in our sample, and that we've got a lot of variability to be able to explain. But I think that this is really interesting data, and I look forward to comments and reactions to your perceptions on this. There were some individuals who actually visited farmers market at least 3 times in the last year. It was about a quarter of the sample. So it's not just a single visit that these folks are reporting. It's actually more common than that. On average, there was a question that asked when you made a visit to a farmer's market about how much did you spend. It was most common to spend about $10, between $10 and $30. And this is broken out in the blue bars for producer markets. So this is what we would think of as a farmer's market like Coit Road or the Shaker Square versus the West Side Market, which we also included in the definition of farmers markets. And you can see that it was common to spend actually quite a bit more on average, not normally distributed, but quite a bit more at that type of a market. Okay, now we asked a lot of other questions around farmers market shopping in addition to the frequency, have you gone and the frequency with which you have gone. We asked about the total months of shopping. We asked about seasonality. Spring, summer, fall, winter. We asked about, did you go to multiple markets or just one? And we also asked and pulled out whether or not it was the West Side Market. So what's interesting here is that on average, in this sample, the average number of months of shopping, it was 3 months. We had a range from 1 to 8. It was infrequent. Only 5% of our respondents said that they shopped across all 4 seasons. Okay, it was much more common. About half the sample said 1 season, and others said 2. When we look at the number of farmers markets visited, the vast majority of folks, 74%, said that they went to 1 farmers market. Okay, although we do have some individuals who went to up to 4 different farmers markets within the past year in terms of their shopping. So this is a lot of information for us in addition to the frequency, and we wanted to take an approach that we could better understand the complexity of farmers market shopping. So we used an approach to create a profile of farmers market shoppers, and we used a statistical of cluster analysis, and this is a lot to look at, but let me just walk you through this. So we took those variables that we've just looked at, those different defining variables, and we put them into an analysis to see if we could create a profile of what different shopping patterns might look like if we grouped people together who were similar on those characteristics. And what we found is that we found 4 different groups, and these are our names for them right now. They may not be the final names, but there are descriptive names of them right now. We have one group, it's quite small, there's only 7 of them, but they are standouts in terms of their frequency of going. So this group of 7 individuals, on average, made 28 visits in the past year to a farmer's market. That is quite different from, as you might recall, the average, right? They went multiple seasons. They were shopping 6 months of the year. Like to know is, who are they? You know, do they differ by age, gender, their education level, etc.? And the answer is no. They don't. Okay? Which made this to be a much easier table. I like actually the way you did this one. It's much less busy. But the answer is no. They don't. But if you think about it, this sampling scheme and the group that we've included, they're pretty homogeneous. They're pretty similar in terms of who they are anyway. Our next question is, you know, do they differ on outcomes that we care about? Okay, so what kind of outcomes do we care about? We care about awareness of farmers markets in your neighborhood. And recall the picture, and that our sample was drawn from people who lived in these light green areas. There was a question on the survey that said, is there a farmers market located in a neighborhood where you live? And 56% of the respondents said that they did not think that there was a farmers market in their neighborhood. We know there is, but they were not aware of it. And these are people who are using, you know, a large portion of them are using farmers markets. So that's interesting. We also wanted to know, have you ever used your EBT card or your SNAP at the farmers market? And among those who had shopped at a farmers market, 66% said that yes, they indeed had. The third question was awareness around produce perks. And what we learned, which really was very interesting, is that only 25% were aware. 75% were unaware of the produce perks program, despite these, you know, beautiful, you know, information documents that get distributed. So our question is, are our different profiles different across these outcomes that we care about? Yes?
The ones that use their EBT card didn't know about this? I mean, I'm just wondering. We'll see. Okay, because it was not the same percentage.
No, it's not the same percentage.
On that high frequency list there, the number of people that have received produce perks is only at 39%, when 100% of them have used their SNAP. Are there any farmers markets people here that don't distribute produce perks? How does that happen?
I think that,
answer that.
right?
I would love to answer that question because I was one of the surveyors. And one of the answers that I was is because there were either no signs posted, they weren't aware of the farmers, but they had no idea either what it was produce perks were. There was no sign posted that had that if you used your SNAP card, that you could use it as produce perks. And they just didn't know what it was. So it was a combination of 3 answers that I got regarding that.
And a lot of them felt it was too much information. They felt as though that they were under the impression they were going to have to share too much of their personal information in order to use that benefit.
Right.
So how do they use it, though, at the market? They go up to a farmer.
Well, that's a sign posted, produce perks.
I know, I understand the
Yeah.
produce perks, but I mean, how do they use their SNAP card without doing produce perks? The farmer just swipes their card and...
If the person is not aware, is normally the vendor that's there is not going to make them
That's what I think,
aware.
the vendors could tell them.
So let's come back to this in just a minute, because these are points for thinking about, the implications.
Okay.
So, a couple of things to me that stood out as somebody who's done a lot of research in the realm of farmers markets and food security and nationally and now really moving into the Cleveland area. I found that the transportation data was startling. 58% of our sample said that they do not use a personal vehicle to get to their stores. And when we talk about food access, we have to be talking about distance. Distance matters, and transportation matters. Many of our people in this survey are relying on somebody else to give them a ride, to ride the bus, walking. And whatever is the closest is going to be the place you're going to go to most often. I looked at national level data, food APS data, APS data. 95% of high-income Americans in this country use their own car to get to food stores. Nationally, among SNAP holder households, 68%. We are well below the national average in these things. And I think it's very easy to dismiss transportation as an issue because it's not an issue for a lot of people who are in the position of power, right? So I think this is that was startling to me. A second finding for me was that a wide variety of food stores are being used by our sample. I mean, you saw the list. You went through all those different places. But importantly on that list, 62% are going to a food pantry, emergency food assistance site in a month. And 60%, which Sue did not highlight, are going to corner stores in a month. So when we talk about improving the overall goals of FreshLink, improving access to nutritious foods among low-income populations, we cannot not talk about emergency food assistance and corner stores. And I think there's a lot of work going on in our city, even in our PRC around this topic, but they're part of the solution as well. And then thirdly, surprisingly, farmers markets are being used. We really didn't know. Because the only data you have about individual user level data on farmers market is the dollar spent. Well, the amount of dollars in SNAP is billions, and very few of that goes to farmers market. So it's like less than 0.005% of the billions of dollars of SNAP are used at farmers markets, but we don't know how many people that is. And I think our data are very interesting and do show promise that farmers markets are an access point. But I think that there's a lot more we could be doing for them to achieve the ultimate benefit. Around awareness, more than 50% who lived within a mile of the market didn't know that. That's something we can address. That's fixable. SNAP use at farmers markets was relatively high. More than 60% have used SNAP at a market if they've been to the market ever in their life. But that's another area where we can improve. And I think most importantly, and to the point that we're talking about here, is we have to do something about raising awareness about produce perks. It's an amazing intervention available in the community. It's resourced not only locally but federally. There's resources for this. I can guarantee you our data are no better than anywhere else, and probably better than, if that, than anywhere else in the country. So whatever we can learn in this area is going to be critical for the national dialogue around healthy food incentives and farmers markets for population promotion. So just in wrapping up, this is a 5-year project. We're in the planning stage, but our goal is to use the data to grow an intervention model or models to try and boost the demand for farmers markets, building on a lot of the lessons we learned here today. So where are we going next? A big lesson we learned in the survey data, and our administrators of the surveys will tell you this as well. I mean, we left every survey with wanting to ask 1 million more questions, right? Because there was so much more to the story. And the biggest thing for us was, if the farmer's market doesn't fit into your broader food habit, it's not going to fit in. It's a very routinized behavior. And so the whole focus of our interview study, which is going on now, is to recruit 30 people who did surveys to then follow up to better understand what are their food habits around buying food, making food, and eating food, and to learn about social network influences on food habits. And so here's an example of a map of one of our participants, and we'll be getting a number of these maps over the coming months and trying to better understand where does a farmer's market fit into the habit. Secondly, we will be releasing 2 data briefs related to these data. This is a tradition within our PRC. The first one is going to be around farmers market shopping, some of the data you saw today. That's going to be released right around the end of February. We're timing our release with the Ohio Farmers Market Managers Network meeting, which is in the beginning of March. We're hoping to be able to present at that meeting as well, which I think these data would be great there. And then secondly, we'll have a general food shopping data brief as well, linking up likely with some of the other food environment data that the PRC collects. In terms of moving to that growing phase of the intervention, this summer of 2016, we'll pilot test a peer-to-peer model of dissemination to hopefully boost demand for farmers market, boost awareness using a peer-to-peer model. And in addition, what the data said to us is that we also need to be doing something at the market level to pilot test a healthy food incentive support program so that when somebody shows up at the market, you know about these programs. And and what does that mean? We don't yet know, but we think that's part of the solution, locally as well as beyond. So that is our very last slide, and we would very much love to hear your questions, discussion, and you can always learn more about FreshLink by going onto our website. So, thank you. Yes. And can you introduce yourself too?
Amanda Osborne, I've worked with Produce Program. I think when it said the lack of awareness of produce perks, it would be highly unlikely that you would swipe your direction card at the market and not receive produce perks tokens. It's very standard practice, especially since EBT swiping is done through the customer service booth and not the individual vendor. I think what the difference is that people don't know it's produce perks, but they refer to it as the green tokens. So the phone calls I field are about their green tokens. So maybe it's not that they're not getting the program or the benefits of it or the actual tokens, but it's just they're not aware of what the true name is.
And that very well could be, an issue around just the language.
That wasn't addressed with the survey.
We didn't say green, but we did show them the flyer for Produce Perks. So we said, have you ever heard about this program? We showed them all the materials, and then...
Does the flyer have pictures of the
tokens? And the flyer has, I believe we showed that flyer that was on there, and it has a picture of the tokens on it.
But there's so much other stuff that they could have missed it. So you're saying that probably it's a higher percentage that actually are receiving the Produce Perks, and they just call it something
impossible to swipe your direction card at the market that accepts SNAP and does the Produce Perks program and not receive the additional match. It's standard practice.
Do you have the numbers in terms of the folks who receive coins and then
Right.
I thought we had
Not
had
on
a
me. I have them in my office though.
But I remember it being something like 85% or 90%, like something really high up there.
Redemption? Yeah,
I thought so.
85% of the people who receive tokens redeem them.
Yeah.
If they get them, so if they
If they get them.
But if they swiped it at the customer service booth, they would have to receive them, unless they went back and swiped a second time, which there's
Okay.
a limit on the day.
Another question back there?
Oh, I just think it would be interesting too to see people's habits of gardening, whether it's home gardening or community gardening, how many, if that differs amongst those.
We did ask if people knew other people who were vendors at a farmer's market or grew food at farmer's markets, or if they know people who are involved in gardening. And I don't know off the top of my head what the levels of responses were for
I
that.
remember it being low though.
Yeah, it was low.
So we asked if they farm or garden or if they know someone who does, but they were very low.
Right here? You, Marilyn?
Maryland? Oh, well, for those that don't know, I just did a tour a few months ago. The East Side Market is opening back up with more stores, which is a good thing. More stores are going to be in that area. I would also like to say something about some of the sites that we did visit. Those that weren't aware of the farmer's market or didn't use the farmer's market or could not get to the farmer's market, some of the locations that we did our sites at have fresh fruit produce that was delivered to the site, their vegetables, their fruits, whatever it is that they couldn't be able to get to a farmer's market. It was also produce dropped off at some of the locations that we visited. And I have a question for Dr. Darcy.
Yes.
On one of the slides, you had something about the social aspect of it. Now, could you go into more detail about that and what all that it entails and what is in the future plans to make that more aware to people who are utilizing
Sure.
farmers markets?
So our idea in the FreshLink project is, one of the main thrusts is to develop a peer-to-peer model that would be, allowing peers to disseminate more information about using farmers markets, using produce perks. We know from data that we have here locally as well as nationally, word of mouth is the #1 way people hear about a market. So how do you seed word of mouth faster, and how do you seed word of mouth in groups that aren't necessarily already engaged in the behavior? And so our focus in the peer health advocate intervention is to, hopefully boost social norms and connections around farmers market produce perks use. And that's what we'll pilot test this summer.
Brandon King, I may not understand it correctly, but it sounded like when they use the card, you get these green tokens. So from the difference in stats, because 85-90% sounds really high in order for redemption. So initially I'm just wondering, if you're getting coins, are they getting the coins?
Right. So when people get coins, I think that was the point. Redemption is very high. So if you get the coins, you use the coins. I think the question, and it's not, our data may not, it raises questions, it may not be the final answer, and certainly we don't have a representative sample of the entire SNAP population. But the question I think that's coming up here is, are people getting the coins in the first place? Are they aware of the opportunity? Even among awareness, there's very low awareness, relatively speaking, about the program. Now, I will say one other thing. When people left our interviews, they were very excited about learning about produce perks. So it wasn't something that was not of interest when people were told. Yes?
Maybe just to shed a little light. One of the things is that when people were using produce perks, this is from my perception, a lot of those individuals that use their cards may not have been from our target population at the food markets. Because a lot of the people that we found that were coming to the different farmers markets were people that lived in the suburbs and other areas that were using their SNAP. So the people that were coming from the say Cleveland or inner city, they were not coming that far. Even though if we were in, no, over on.
We were in Tremont.
In
We
Tremont.
screened so many people.
We screened.
It was very hard to find someone who lived in Cleveland.
So it's not that, we're not saying that it's not being successful. It's just from the target population that we were actually assigned to reach, those individuals were not coming or were not receiving the services. So is that making sense?
Even the Shaker
Even the Shaker Square. We had people that were, one of our surveyors actually went over to the Rapid area, I believe it was Ms. Brown, and was taking surveys over by the Rapid that did not come over.
Right.
They came to shop, but they went in the Giant Eagle, and the farmers market was right here. So they didn't assume that the farmers market was for them.
And that's getting at the social access issue, right here.
I'm not as familiar with all this, so when you say that they swipe their card, they're doing that with the individual vendors at the farm.
At a central booth.
So they have to go to a central booth.
To use EBT and to get the produce perks does happen in a central booth, yes.
And then at the central booth.
Except for West Side, yeah.
And so that's where they would get the tokens, the
Yep.
produce group.
Yeah, and the EBT tokens as well. Both of them are token systems.
Wait, what's the difference? Wait a minute.
What
type of token?
So SNAP is a token that you use, and then there's another token which would be EBT. And the way that most farmers markets operate is there's one produce perks. There's one central point of purchase.
I'm aware of that. I didn't realize there were two
Tokens, because they're two different funds that are going to pay for those programs.
So a person could swipe their EBT card, that is their SNAP card, and not get produce perks.
In theory, I mean, it's possible. Like, we're hearing that it doesn't seem likely from a farmer's market manager perspective.
Right,
So
but
this
it
is-
happens.
Yeah, so this is why I think the follow-up and qualitative data collection and really doing some in-depth interview and following, probably doing some participant observation of, what that process is like would be really, really helpful to shed light on. What we're seeing is, it can't be right? There's something that's not, something's not adding up.
Especially
right?
on the group of people that, it's in a small group, but
The high
doesn't-
frequency, yeah.
High frequency,
Yeah.
that doesn't get
Yeah.
it. It's like,
Or they don't know.
yeah.
Dieta?
Well, I just wanted to say that me being a vendor at a farmer's market before, receiving the tokens that come from customer service, because we do not accept unless you have the little, what do they call the little thing that put on your phone that you can accept your credit cards. If you don't have that gadget at your booth, you will have to go to customer service in order to retrieve, even if you're paying cash, you would go directly to the vendor. But if you're using some type of credit card, you would need to go to customer service. But if you go to customer service and you swipe an EBT card, they automatically tell you, here's your tokens, and they tell you what they're used for, which is only fruits and vegetables. So 9 times out of 10, they will get them. But sometimes people will get them and give them to other people because they don't use, they don't eat fruits and vegetables, but they're being used, so.
Yeah.
And another thing I've noticed when I do a lot of my outreach is that a lot of people just aren't available during the time that they're open. So maybe, as we progress with the whole corner store things, maybe that's something we could, work on, is perhaps making it more available regularly.
Yeah.
Because I think it's a big inhibitor for the working poor, is that just the availability of it is usually closed by the time they're out of work.
I guess I'm wondering if the seasonality has any impact on the, because I would imagine that a lot of them have a lot smaller selection in the winter months versus the summer, and if they don't, maybe one shuts down that's in their mile radius, where they would turn for food, and if they even have access to the healthy, nutritious food, I guess.
Yeah. I mean, most people were going one season or two, and those were not the winter seasons. So, but I think the question around the food habits is really important. So if we're giving a solution, like a farmer's market, but it's only a really short-term solution, is it worth shifting all of my food habit behavior for that? That's a huge shift for people. So how do you make it easier to do the shift? And I think that's why we say the supply and the demand. How do we also think about longer seasons and other strategies to, have greenhouses or whatever so that you can extend the season?
To the one.
Right. Global warming.
Just going all the way back to talking about people within the 1 mile radius don't know about the market that's in their neighborhood. It seems obvious to me that working with churches, from the pulpit is the best word of mouth, available on the planet.
Yeah.
So, and I'm just kind of wondering how many people here are...
Maybe market managers could offer, do you use churches for your dissemination, to communicate to the neighborhood that...
I think I got a list of questions, but I can answer that.
Okay.
We do. We basically try to use as many institutions in the neighborhood as possible. But quite honestly, most of the problem is not just time of day; it's the number of days and the length of the season. And so, it really is trying to create that social engagement more than just a pop-up place. Because they don't know when to come. Like I hear people that say they've been driving by my sign for 5 years and always wondered when it was, except the sign says Friday. So, it's not a part of what they do, and they don't see it often enough to get any clues. So we really, personally, I've tried to engage them in different arenas on non-Friday days, in their spaces instead of our space, and then actually invite them to our space. And it has absolutely worked. Even with having fewer things to pick from, because it's not just them going to the market, they're coming to our market because there's a relationship there. So some of the social fabric is being built outside of the actual farmer's market.
Absolutely. And I think that's, to the point that we said, I think that there's a peer-to-peer model that could really help, but we think there's probably a lot of that could be done to support making the space more of a space that is our space,
Exactly.
There was one person that, Elaine?
I have a quick question. I did more of a comment just for you to confirm to folks too. You could actually go back to those 7 frequent users and as a first step, right? And just confirm if you gave them more information, spent a little bit more time and said, did you ever get the green tokens? Did you ever get the other tokens? That would be a first step, I think, even just sort of clear this out. But I guess just as a general comment about what I think is just amazing about this conversation is that this is the collaboration. I think we've always hoped that, these comments are now, they all, working backwards, and you didn't talk a lot about that, the rapid,
the PDS, the rapid response.
That's sort of what this is. So at some point, if you could comment about that at the end.
Okay.
This notion of it being this feedback is all part of this process. It's just wonderful. And also just don't want to make sure that OSU doesn't feel, or whoever the folks that are really Produce Perks folks, that this is what it's all about, coming and finding out things and talking about them, but hope nobody feels as though, just want to make sure that we're very conscientious of that this is not a critique of.
Well, and I think our partnership is with OSU, with the Food Policy Coalition, with Job and Family Services. All of those are part of the team. And I think the solutions, all of them will be involved.
Yes.
So.
Right. Jointly getting it figuring out and getting to the bottom.
Yeah. Darcy, I just wondered, from your previous work that you did in South Carolina in farmers markets, in terms of, if I recall, that one of the really big reasons people came to those farmers markets was the social connection part that was just referred to.
Yeah.
I'm interested to see what you think are sort of similarities and differences between South Carolina and what you're studying now.
So, I think that markets are social spaces for a lot of people. I just don't know if they're social spaces for low-income people. So the literature, we actually did a literature review, and the data show for high-income people, all kinds of social benefits at farmers markets. It's a third space for middle-income, high-income people. For lower-income people, that is not confirmed in the literature. I think that because of that, you have to be very purposeful then if you want it to become a third space, if you want it to be the social space. And I think one of the ways that farmers markets potentially have a bigger effect than, say, a corner store or I'll just use corner store, is because it is a space that also cultivates community. But if your community isn't cultivated there, then that's not a relevant argument, right? And so I think that it could happen. I'm just not sure it is happening. And I think what our job in FreshLink is to try and better understand how can we facilitate it. And I think personally that we're now planning what the design of our dissemination intervention will be. I think we should have an arm that is very much a peer-to-peer. And I think there's another arm that could be very much around the organizations, the market leading more, engaging churches, etc. So that we don't know which would be better, and maybe it's the synergy of both.
And just to follow up on that, I was thinking that perhaps, like you said, the low-income populations, and from your demographics, they're mostly single parents, and we don't actually know, well, maybe you do have the data on the ages of their children, but maybe a subpopulation of moms with little children, and we all know how hard it is to go out to the store with little kids, especially if one's not walking and maybe one's toddling. I mean, you want to go to the closest place.
Absolutely.
The easiest parking. But if you're not driving and it's wintertime, you're not going to do that.
Yeah, absolutely. So those are all really good points.
But when we were doing most of the parents that had children at Freedman, like Yvette said, those people was coming from a long distance. They only come there to socialize because of the activities that they can get their kids involved with, like the playground and space for them to run around and play and shop. That was the reason they were coming to that market so far away. Yeah, Freedman, That's a good location.
I think, too, to piggyback off of what you just said, a lot of times when we did the surveys over the phone, the biggest thing that the parents were saying to me was, it's not the fact that they didn't so much know about the farmers market. They would love to have been able to go more frequently, but as we said in the presentation here, transportation is a big, big factor. They want these things to happen, but how am I going to get there? I'm depending on somebody else, and you know how it is sometimes depending on somebody else. So I think a question here is, how are we going to be able to set it up where the people that really want to get to these farmers market and eat better and for their families, how is that going to be made possible? That's a big fact. Wanting the desire, but yet not having the way to get the ways and means, that's the big factor here, And
so next year, I know it's the city year of alternative transportation. So if they knew about this.
Yeah, that'd be great. That's a really good point.
My question, someone said something about socially as far as the churches is concerned. I recall because I didn't want to step ahead of my position. I remember I asked Christian about some flyers because I work in the hair industry, but I also am also on pastoral staff. And so I was able to connect with different churches. And whereas I was being asked about the information, but also at the different barbers and stylists that I knew, as we would get together on Mondays, I would talk about what I was learning, and a lot of people were very open, like, we've never heard about that. So, another place other than your churches, your barbershops and salons stylists they are into everything when it comes to their customers. And one thing we know about female, we are going to get our hair done. and their stylist is like their doctor. They will accept the advice of a hairstylist over their doctor. So therefore, I mean, I'm just being honest with you. This is socially, other than the church, being able to use those particular revenues to go in and create an alliance with them in order to service the target population we're trying to reach.
Yeah, they may become the peer health advocates. So that is the million-dollar question. Who is the best peer health advocate? That's what we're trying to better understand. Back there?
Are there any connections right now between RTA and the farmers markets?
That's a good
question. So maybe if you take a bus to a farmers market, you get more green tokens?
Yeah, that's a great question. Anybody know? So partnership with the farmers markets and the RTA?
Something that we can connect, because it sounds like the farmers markets are connected with these.
It's better when they take a square.
Yeah, that's a great question that we could look in, especially with the year of the alternative transportation, to link up programs like Produce Perks and public transportation. The triple P, quadruple P program.
I have another question about the farmers markets being at 100% for SNAP, or being able to use SNAP. What do you attribute that to? People in this room.
Exactly. I mean, there are a lot of leaders right here in this room today, and we ask, do we need a food policy coalition in our city? I think that's a question on the table right now. And I would argue that the data today give even more reason why we need a food policy coalition, because we have the laboratory because of the coalition, and we clearly have some opportunities to enhance, and some of it can be done through policy. Some of the big obstacles, they have to be done through policy. So I believe that the city required any city, if a farmer's market was on city property, and they availed city property to markets, it had to accept EBT.
Well, my last question, my statement is that, we did the survey, we went out, we're very excited, but it was very heart-wrenching when you talk to a mother that potentially wanted to do better, wanted to know about how to take care of her child, wanted to know what things that were available. And for us, I believe we've done an excellent job. What we didn't know individually, we would ask Christian. But what happened is that it's not that they are that way because they want to be. Right. Some people want to know better. They want to know how to change their eating habits. They want to know how to, change the culture, of what they were taught. Right. So everybody is, my thing was that, and one of the things Darcy, I remember during my interview, Darcy said something to me about, we want to make sure that we preserve their ethical and moral rights. Some of the questions that we were asking, some of them felt as though they were quite personal, but we had to, use our skills and resources as professionals to win their trust, for the information that we did receive, for it to be where it is today. So a lot of questions that when we asked them, we got a lot more information than we ever expected to get. Yes. So, and I just say, for instance, Ms. Brown was dynamic. She was dynamic at educating me on the produce perks because I was at a loss. But there were women that were like, well, I would use it, but what do I do? Well, where do I go? Or how do I, so it's not like they don't. They want to know better because you have a lot of babies raising babies now. The generations have changed, and so, and you have mothers that are in their 30s that have grandbabies. Mm-hmm. So when you're asking a woman as far as why she's not able to go into the community or why she's not doing better shopping habits, some of them have 4 and 5 babies that they're trying to get on a bus with and carry 4 and 5 bags, and so they wait on somebody to take them to the store. Yeah. And so, and in that being the case, we had to be mindful because sometimes we could become judgmental. Because sometimes you would look at them like, well, why do you have 4 and 5 babies? But that's not the question at hand. The question at hand is that how can we help you? And that's more than anything that I think that the program really changed my perception. You know, when we started to talk to people, and it made me want to dig out more resources on how to make myself consciously aware of being beneficial, even though I'm asking you information that you normally wouldn't share. I had to make sure I knew some things or different resources that they could get in contact with, even though we were not, it was not required of us. So yeah, it's a two-way. So therefore, I totally say these individuals that shared the information were truly dynamic people. Some of them had education, some of them did not. But these were really, I should say, they were some of the most brightest individuals. They were disciplined their children in manners that was quite different than what I knew. They were very, very open, I believe, in ways that I totally was not prepared for.
That's true. We were very indebted, not only to all the people, there were a lot of people who were involved in all of the sites, but to the actual participants who
absolutely.
Were so gracious in giving us a significant amount of time and answering those questions so that we would have these data to be able to share.
Yeah.
So, okay, well, on that, I would like to thank everybody. If you did not sign in, please do sign in on the sheet that's really valuable to us. There's